I'm so happy that you were able to visit Denmark and Copenhagen.
Yeah, me too. It's been neat. I feel like we've had these glimpses of each other over the past couple of months in Italy and London and now here. So really appreciating getting to know you better and to see the really important work that's happening here too.
And you sort of new leader in this field in one of the top universities, top mindfulness centers in the world. So we are really honored that you took the time to visit and to discuss how we promote mental health and how to prevent depression. That's the two things we would like to work on. So how we can promote better mental health and how we can prevent depression.
Wonderful. Yeah. And it's neat coming to Denmark, to a society that is known for happiness and hygge.
Yes.
And so it's been interesting to spend a little bit of time here so far, just seeing the structures politically and socially and interrelationally, how people are set up to foster well-being in this society, and to think about if and how mindfulness can engage with the wisdom that's already here. We are such a privileged population, so we have free healthcare, free education, it's safe here, it's so many really, really good things, but still there's a problem with poor mental health. There's something in our culture that many people are not thriving, and I think we have a responsibility as researchers to make these evidence-based programs available into the society. And I don't know, what do you think is most important at this point of time? Yeah, I just completed a review of systematic reviews and meta-analyses focused a lot on MBSR, like mindfulness-based stress reduction, and was impressed with the evidence that's been building over the last 40 years on it, as well as MBCT, like mindfulness-based cognitive therapy. And so for me, if I, as a scientist, trying to be a responsible scientist, only want programs to be rolled out to the public if they work. And if they don't work, let's not waste people's money on it. And so what I see with the systematic reviews that are coming out on MBSR is pretty consistent medium-sized effects on reducing stress, which is a good thing given it's called mindfulness-based stress reduction. So if the evidence is showing it reduces stress, that's a good thing. And then also seeing pretty consistent effects on anxiety symptoms, not necessarily an anxiety disorder, but anxiety symptoms. The anxiety disorder piece, I think we still need some more careful work there. And then actually impacts on depression too, both MBCT, but surprisingly MBSR has been showing to have effects in that domain too. And then also on chronic pain. And so for me, I'm feeling more confident that there really is something there. And so one of the things that you and I are working on in collaboration with each other is developing the global infrastructure, or I actually like to say global infrastructures. It's not like ours is the only way to go. There's many ways to go, and other groups doing this too. But as governments are starting to look at covering evidence-based mindfulness programs like MBCT and MBSR, there's just a real need to make sure that we've got high-quality, well-trained instructors and the infrastructure there, so that if a health insurance company or a government is considering reimbursing for these programs, that the instructors are there that can really be trusted by society, that they have standardized training programs and quality control and quality assurance. And so we're seeing governments in places, or health insurers in places like the United Kingdom and Germany. France is starting to consider covering MBSR for cancer patients, for example. The United States, Medicare and Medicaid is starting to reimburse for MBSR in some regions if it's provided by psychologists or psychiatrists. Medicare and Medicaid's covering MBCT now in the United States. So it's starting to happen. And so one of the next steps, at least that I'm seeing right now, is to really be developing those infrastructures so that we can make sure people are getting, you know, the best quality care that they can in an evidence-based manner. So those are some of the ways that I'm seeing it rolling out right now too, in the different travels that I've been doing and meeting with all these different people and presenting to different governmental bodies and stuff.
And you are from a public health, you have a public health background.
Yeah.
And I think it's really important that we also take care of those who are well. And often healthcare professionals and health planners, they are occupied with the problems of those who have a disease. But I think it's important that we need to take care of those who are well, because it is a public health issue with stress, anxiety and depression. What do you think?
Yeah, I totally agree. I mean, I remember a talk you gave in Italy a couple months ago showed a figure of just like the population distribution of, say, well-being. It could be anything. It could be, you know, anxiety or depression or stress. So there's people at the very far end that have like a depressive disorder, for example, but then there's everyone else that have depressive symptoms. Like we all feel down sometimes, and some more than others. And so that population or public health perspective looks at ways to shift the entire distribution in a healthier way. And so mindfulness programs are increasingly looking at doing that. So say something like Headspace or Calm, like two of the most popular app-delivered mindfulness programs. You know, Calm, last time I saw, they're getting 40,000 new users a day.
Wow.
And Headspace has had 5 million people, at least last time I saw, sign up for it. So if we think of like millions and millions of people getting access to sort of these maybe lighter touch mindfulness programs, it might start to nudge people, populations in a healthier direction. Similar around health insurance coverage. So at the moment, a lot of people who take mindfulness programs are upper middle class and white racial ethnic background, and those are people that have more capacity to pay for it and maybe more power and ability in their lives to do that sort of thing, and are also often taught by people of white racial ethnic background who are upper middle class themselves. And so that's one of the other directions of movement is, say, if it starts to be reimbursed by health insurance companies, then suddenly the price comes down and the access comes up. And I think the conference that you're hosting in next year has an emphasis on diversity, equity, and inclusion.
Yes, we call it diversity and equality, and leaving no one behind, which is a sustainability goal from the UN. Leaving no one behind. I think it's really important because every citizen in a country not thriving is a burden to all of us.
I totally agree.
And we have a common responsibility.
You know, I think with me coming on as director of the Mindfulness Center at Brown, one of the things that I'm finding is I'm hearing from a lot of different people and a lot of different organizations about what they want for the field. And one of the strongest things that I hear worldwide is a desire for increasing the diversity and equity and inclusion of people who take mindfulness programs, but also people who teach mindfulness programs. And how can we use approaches like community-based participatory research or creating opportunities to just meet different cultures where they're at, or different social classes where they're at, or genders or age groups or intellectual ability. And so in my opinion, it's not only important, but I feel like worldwide people are really feeling that importance and wanting to act on it and are acting on it. I think with our Global Mindfulness Collaborative, that's a collaborative of people right around the world, including countries like Mexico and Argentina and Spain and South Africa. And so that's one of the benefits I'm finding is these cross-cultural, cross-national collaborations help us see how programs like MBSR are rolled out in those cultures and in those languages by people who live in those cultures and in those languages. And then what they learn can be fed back to us in our countries, like in the United States, that is a melting pot of many cultures, so that we can use the best practices that they're finding and also bring in people from other cultures within our country to train them up to be instructors or to just meet their cultures where they're at and see where the magic happens when the mindfulness programs meet other cultures and other groups in really respectful ways. And there's a scientist, Jeff Prue, who's at Oregon Health and Sciences University, who is Native American himself and works with Native American communities to really meet them in a very respectful way and to explore how MBSR could or could not be used by their cultures, with a particular emphasis on managing diabetes. And it's been wonderful to see the approach that he's taken, that has taken years and a great amount of time and respect and learning from each other to now create this program for these Native American communities that really seems to be appreciated by the culture. And so I think there's many opportunities in those domains that I'm really starting to see happening, but we're still in that early stage. So there's really a lot of opportunity right now in the field to grow and meet people.
Some years ago, we had a meeting in Oxford on the topic of research, which direction to go, and what I took home was that implementation, mechanisms, and teacher qualities. Where do you see the field just now in terms of research?
Like the sort of
bleeding edge. Where do we need to go? Where do we need to focus on research in mindfulness? Because it's the MBSR program is working across cultures, even in a war zone. Then for some people, they can learn how to have some kind of inner peace, even under such extreme circumstances. But what do you think is most important in terms of research? Where should we focus our attention?
I think mechanisms are still a big topic, both biological and behavioral. I think some of the areas that I'm really seeing around like implementation science. So a lot of the studies in mindfulness have been pretty early stage studies, like stage 1, 2. We need to get more into stage 3, 4, 5, and to really look at what do governments look for in terms of behavioral programs, and then how can mindfulness programs insert in to the way that health systems work, so that we're trying to fit a round peg into a round hole instead of a square peg into a round hole. And I've seen maybe 4 or 5 cost-effectiveness studies on something like MBSR, which is not very many at all.
No.
And that's one of the other key things that health insurers look at, is it's one thing if it works, and it's another if it's cost effective. And there's some work by Dr. Herman in the journal Spine on a randomized controlled trial of MBSR versus cognitive behavioral therapy versus usual care, cost effectiveness, showing that MBSR actually reduced costs to the healthcare system. But that's just one study, and just in lower back pain.
I actually did some similar study looking into disability pension and also costs spent in the healthcare system, and showed that patients with chronic pain, that they got better and reduced the healthcare costs. But in Denmark, and I think many places, people are interested in creating their own intervention or a new intervention. And I'm sort of against that, because I think it's already we already have one that's so tested for so many years, a complex intervention, and it has shown effect. So I'm more eager to have more people joining the MBSR than creating a new intervention.
Yeah.
What's your take on that?
Yeah. Yeah, I'm working on a paper with Willem Kijken on that, around if, when, and how to adapt mindfulness-based programs to specific disease conditions or particular population groups. And so I think my understanding with cognitive behavioral therapy, for example, is started off with one particular cognitive behavioral therapy approach, and then it started to get adapted to different patient populations, and then they reached a point where there were so many customizations that a psychologist couldn't learn them all.
No.
And so now there's some work happening where they look at transdiagnostic approaches to look at how cognitive behavioral therapy can work across disease conditions. And so with mindfulness-based programs like MBSR, mindfulness-based cognitive therapy, or mindfulness-based eating awareness training, or we've developed mindfulness-based blood pressure reduction, for example. And so I have yet to see a head-to-head comparison, even of MBSR versus MBCT. And so it's still a bit of an open question about if they work. My feeling is that with certain patient populations that we may be able to boost effects if we train people up in mindful awareness, like with the blood pressure study. We train people up in their awareness of their thoughts and emotions and physical sensations and work on their attention control, but then direct those skills to their relationship with the things that we know influence blood pressure, like their relationship with their diet and their physical activity and their medication adherence, alcohol consumption. MBSR doesn't really do that, and directly, like explicitly. So in my opinion, it's a bit of an open question right now that I would actually like to see the science answer. And then we'll just know, one of the studies I want to do is mindfulness-based blood pressure reduction versus MBSR. So yes, we're showing pretty big reductions in blood pressure, but if we then have to train up all these instructors in MBBP, then that could be inefficient if it's not outperforming MBSR. And so I think my personal opinion anyway, is to allow people to adapt it as they see best, but then to make sure we're doing the science to see if it's worth our time, so that we're not wasting resources having people trained up to deliver all of these adapted programs when one might be fine. But from my read of the literature right now, there's very few scientific tests putting mindfulness programs against each other to see if they do outperform each other or if they work differently.
But I think one of the big strengths with MBSR and MBCT is that it's manualized, that it's tested in so many randomized controlled trials. So if you want to make a new intervention for stress, you will need maybe 20 years to get the same amount of research, and it's more efficient to educate some people in order to teach MBSR, and then from a public health perspective or a health planner perspective to put your money in that. Because the research is so much stronger than if there was only one randomized control on some new intervention.
I think if we think of there's this model called the NIH stage model that has about 6 different stages of research. So stage 0 is like basic research, and then stage 1 starts to be like a clinical trial, and stage 2 starts to look at efficacy, and it gets moving farther and farther out into community-based research that's real life. And most research stops after stage 2. And then it never goes farther because whatever reason, the professor doing the research kind of moved on to other topics or ran out of funding or whatever it is. So MBSR or MBCT, they are ones that are going through more thoroughly through the other stages. So from a implementation science perspective or from a health policy perspective, programs like MBSR and MBCT, are probably safer bets for evidence-based programs. I guess from my perspective, I don't want to put a damper on any amazing new programs, but just realizing that it does take time if they're gonna outperform something like MBSR and MBCT, let's have them, but just recognizing that it does take a good long amount of research that requires replication by independent groups and long-term evaluation and effective control groups and all that kind of stuff to make sure that it's really strong methods. And I think these days with the media and just the public interest being so strong in mindfulness, it's people are picking this stuff up. And then if we look back at the evidence base, well, where is the strongest evidence so far? It is areas like, MBSR or MBCT, acceptance and commitment therapy is developing out more now. Dialectical behavioral therapy is developing out. But that's, that's sort of my perspective on it anyway. But yeah. Thanks.
To me, compassion is the outcome of mindfulness. Like if you are present with a non-judgmental awareness, then the outcome naturally is compassion. But also, I think it's important to have specific programs that specifically focus on compassion. I know that the research is not as strong yet, but I think it's also good that we have something that's pointing directly towards compassion for healthcare professionals, maybe for caregivers, for...
Yeah, I mean, we're certainly seeing, like in the United States, fast increases in programs like mindful self-compassion, for example, MSC. And I haven't studied it much myself, but know some MSC instructors, even know one instructor who does MBSR as well as MSC, and hearing the differences between them and the value in them. Like this one instructor who does both, I was asking her, when do you think MSC is like particularly effective? And she said, I've been working with some war veterans who have PTSD, like post-traumatic stress disorder, and MSC seems just to really be a good fit with that particular population. And that's just, an instructor telling me. I haven't seen the research on it, but I think that compassion piece seems to really resonate with a big segment of society. And there was that paper, systematic review on mechanisms of mindfulness by G.U. And her colleagues. And it was primarily on mindfulness-based programs like MBSR and I think MBCT. And they looked at self-compassion as a mechanism. I think there were only 3 studies that had looked at it as a formal mechanism, like using formal mediation analyses. And only 1 out of the 3 studies showed significant mediation. The other 2 didn't. And so, it's thought that MBSR and MBCT have compassion, self-compassion kind of infused throughout. And so it gave me some pause to see that it wasn't a significant mediator, at least in those 3 studies, like 1 out of 3. Maybe that's not a lot of studies, but it may be that a program like mindful self-compassion cranks up the compassion that much more, so that that may itself be like a way to ensure that is a true mechanism through which the program may be working.
Well, what are you writing on now? A paper with Willem?
That one is looking at, they had a warp and weft paper. It's sort of a famous paper that came out a few years ago to look at what is the essence of mindfulness-based programs. That is what a mindfulness-based program is. That doesn't change. So something like having a strong component of meditation training, or having like a live teacher that can be providing feedback to participants, and then so that's like the warp, and then the weft is where we might adapt it to different populations. And so we're extending that out to look at really almost step by step. If someone wants to adapt a mindfulness-based program, what are the questions to ask ourselves if it's worth adapting or not? And then if it is worth adapting, how do we go and about doing that? And then another piece that we've been looking at is around almost like taking a step back like Oxford has a master's program to train people up and to become MBSR instructors and MBCT instructors. At Brown, we're also developing a master's program, but also do teacher training of MBSR instructors. And so this paper is starting to take a look back around the training program. Should we be training instructors to become mindfulness-based program instructors? And then they can specialize in MBSR or MBCT or MBEAT or mindfulness-based relapse prevention. And so is that a way, just as we see the world moving forward, a way to provide a fundamental foundational training of mindfulness instructors in the basic elements of the warp, of what the essence of a mindfulness-based program is, and then from there they can customize to what they decide is best suited for them and the patient population they look to work with. And so this paper is developing out ideas around those lines right now.
Do you think that it's able to learn to teach mindfulness from a book, or do you need to go through a professional education training? If you're a nice person and you meditate and
right, yeah.
What's so special about the education?
I think when I think about what creates conditions for someone to learn really well and quickly, with some of the philosophical foundations of mindfulness-based programs being like in Buddhist philosophy, one of the elements of Buddhist philosophy, what it takes to learn things really well and really fast is sort of three things. So one is a teacher, another one is some teachings, and a third one is a community to practice with.
Yes.
And so MBSR and MBCT instructor training provides those three things, for example, so that someone can be learning the mindfulness, the essence of the mindfulness itself, but then have a teacher to give them customized feedback on their knowledge and also how they're presenting to a class. And there's things we need to be really sensitive to, including people's history of trauma, for example, or diversities in participants, and then also having a community to practice with. So just a book will give some teachings for sure, and sort of a teacher, but you don't get that feedback. And we also don't get a community to grow with. And so, that would be my personal recommendation. And if I think of anything I've learned really well, I had all three of those things, whether it was learning how to play mandolin, I had a teacher and some friends to jam with, and the music itself to learn, or getting my PhD in a college setting with professors and other students to work with. So, even when I think about reflecting to myself, the things I learned the best had all three of those. And, Becca Crane and her group at Bangor University, as well as at Oxford and Exeter, they've developed the MBI TAC, like the Mindfulness-Based Intervention Teacher Assessment Criteria. So that's the best tool I'm aware of right now to really measure teacher effectiveness. And so I think increasing the use of that tool is a really effective way to gauge instructor quality in a quantitative and qualitative manner, along with doing the research to see if people's ratings on that teacher quality scale actually predict participant outcomes too. So that's one of the other areas I see, just helping us just move the field forward in terms of high quality teacher training and also measuring the actual quality of the teachers themselves.
I like that you have to train in a community, and I like the symbol of a circle. This is from the town hall in Aarhus.
Nice. Wow.
And we have people can come in once a week for an hour and practice and sit in a group. And we have this in Aarhus and in Copenhagen also. So every Thursday from 4 to 5, then it's a possibility to join a meditation group.
That's really neat.
And I think that's what we're doing also worldwide with this community we're having with the Mindfulness Circle, how to, something that's been really precious to people around the world, to dive into what is the best research and what is the best education, and how can as many people as possible have access to these programs or ways to train their mind in order to get some more inner peace.
Yeah.
Thank you.
Yeah, thank you. Yeah. Looking forward to more conversations over the next couple of days.